Hi guys, let's talk about molding. So molding is a term used to describe the change in the shape of the fetal head as it passes through the maternal pelvis. Okay, so almost every head undergoes some sort of molding, except fetal head that was birthed through cesarean delivery. Okay, other than that, all the heads undergo some sort of molding. I get it. So in labor, as the head descends, in response to the downward pressure from the uterine contraction, the fetal skull bone overlap. Okay, so what happens is that the presenting diameter receives the pressure from the uterine contractions, okay, and try to overlap, reducing the size that it has to navigate through the pelvis. However, the diameter at its right angle will rather push outward, okay, then it becomes elongated, also giving way for the presenting diameter to reduce in diameter. So let's say if you take the normal sub-occipital pragmatic diameter in the normal delivery, like this one, sub-occipital pragmatic, we're gonna have molding takes place in its angle, diameter has its right angle, and this is going to be the mental vertical direction. Okay, now if molding happens in this particular way, it doesn't result in any damage to the cerebral membranes and its underlying blood vessels, and that's the normal one that we expect. However, there are types of moldings that result in edema and congestions of the cerebral membranes, causing cerebral irritation, which is also accompanied by damage in its underlying blood vessels, resulting in intracranial hemorrhage, and that is what we don't want to happen. Okay, so these type of moldings are called the excessive molding, the upward molding, and the rapid molding. In excessive molding, it happens in cases where there's prolonged labor. So for example, in a case of cephalopelvic disproportion, where there's a mismatch between the presenting fetal head and the maternal pelvis, we have molding taking place in excess, in the quest to overcome the disproportion and navigate through the maternal pelvic. So molding becomes excessive. Again, in the case where we have a preterm baby where the bones are not completely ossified, the fetal bones offers little to no resistance to the uterine contractions, thereby excessively overlapping, resulting in congestion and edema of the cerebral membrane and its underlying vessels. I hope you get that one. Now when we come to upward molding is usually seen in cases of occipital posterior position, where baby is born in persistent occipital posterior position, where we have the occiput at the posterior part instead of the anterior part. Again, it can also happen in the aftercoming head of the breech. In the presenting diameter, or in the case where the presenting diameter is occipital frontal of 11.5, we have molding occurring in its opposite direction, which is the submental pragmatic direction. What happens in that direction is that if the molding is occurring in the submental pragmatic direction, the flux cerebri is pushed upwards. Now the flux cerebri is a sickle-shaped dural matter that separates the two hemisphere of the brain. Okay, and the flux cerebri also forms a junction with what we call the tentorium. The tentorium too is a dural matter at the posterior part. Okay, so when we have molding occurring in the submental pragmatic direction, now there is in the junction between the flux cerebri and the tentorium. Again, its underlying blood vessels also undergoes trauma, it tears, and there's hemorrhage. I hope you get it. Yes, there's hemorrhage in that instance. This leads to cerebral irritation, and sometimes it can even lead to permanent cerebral damage. The last one we're going to talk about is the rapid molding. Yes, the rapid molding. In rapid molding, we see what rapid compression and decompression of the fetal bones. Okay, in that case, we have what the cerebral membranes were damaging or undergoing what trauma, and that is the commonest cause of what cerebral membrane rupture. Now, in what rapid molding, we see it in cases of what precipitate labor, where labor starts and completes within a duration of 4 hours. Okay. Also, it can also be seen in what breech head delivery of the head in breech, because in breech delivery, the head is born very fast or rapidly, and that can result in what rapid molding. Okay. Now, our focus or our concern is not even the membranes that are stirring, but the bleeding that is associated with the memories that is there. We have large vessels as such that would break, resulting in what hemorrhage in these blood vessels, and that is what going to cause increased intracranial pressure. Now, for babies that are born that exhibit signs of cerebral irritation, which includes seizures, stitchiness, lethargy, apnea, emboldened fontanel, poor feeding, twitching eye movement, all these babies are supposed to be assessed by a pediatrician, and we anticipate the administration of vitamin K injection based on their birth weight. These babies are also supposed to be caught nursed, okay, and they should be have minimal handling. Again, they have to be observed for a period of at least 24 hours. So this brings us to the molding. We have discussed how normal molding should take place, and we've also spoken about the 3 types of abnormal molding: excessive molding, upward molding, and rapid molding. Thank you for watching. Remember to like, comment, share, and subscribe. Bye.